Hi, welcome to another edition of Johnston Health Talk. I'm Liz Thurston with Johnston Health. Today we have a great show for you. We have Dr. Aaron Leininger here. He brings several years of experience in concussion management and musculoskeletal ultrasound to add to the sports medicine resources available in Clayton and Johnston County communities. He's board certified in primary care sports medicine and completed his fellowship and family practice residency at Cone Health in Greensboro after graduating from medical school at UNC Chapel Hill and undergraduate at Clemson University in South Carolina. Dr. Leininger is a physician with University Orthopedics and Sports Medicine in Clayton. Welcome to the show, Dr. Leininger.
Of course, thanks for having me here.
So today we have lots of things to talk about. Tell us a little bit about your specialty, about sports medicine.
Right, thanks. So sports medicine, primary care sports medicine to be more specific, is a relatively new specialty. You know, it's kind of been around probably in the 20-25 year range or so. And I've been fortunate to be practicing it myself for about 6 years. And it's, you know, orthopedics has always been associated with sports medicine because, you know, musculoskeletal injuries are such an important part of sports medicine. But there's other aspects of sports medicine that are not necessarily as specific to the musculoskeletal system. Problems with the skin and wrestlers and other things like that, some cardiac issues, pulmonary issues, asthma, etc. And recently, as we've learned from lots of coverage in television and in the media and the movies, concussion, of course. And so these are areas that the orthopedist didn't have quite as much experience in, and it was kind of determined, and it was clear that there was a need for a primary care group that had some extra training in musculoskeletal medicine, etc., diagnosis and treatment, to be able to step in and help out athletes and help people get back into healthy physical lives.
And that's great, and we're going to talk in detail on a lot of those topics today. But I've noticed now that you have this little thing growing on your face.
That's right.
Much different than what we normally see. Tell us about, what is it, Movember,
Right.
and you're participating in that and men's health,
Right.
and creating awareness of that.
Right, thanks. Yes, I like to participate in the Movember movement. There's kind of No Shave November and Movember. I've always kind of been partial to mustaches. Unfortunately, my wife is less partial to mustaches. But when I heard about this wonderful charity about 3 or 4 years ago, I knew it was something that I wanted to support for the fun of it. It's a great cause, and there's lots of fun mustaches that people will grow for it. And also the fact that mustaches and facial hair is kind of a male thing, so it is a great symbol of men's health, and that's basically what Movember is there to support. And so, prostate cancer, testicular cancer, mental health issues including suicide. These are ways that were identified back in Australia, where it was started several years ago, as major contributors to premature death in men and specific to men. And so when we bring awareness to these and support research and ways to improve these sorts of things, hopefully we're helping out to save lives.
And I think it's great because men's health is so important, and to create this awareness and to make it fun for men to get involved, not just men, but women are getting involved as well. And,
Right.
And the foundation has over 50 million members now, is that correct? And they've raised
Right.
like $750 million since 2003. So,
Right.
We appreciate you taking part in that effort.
Yeah, thank you very much. And as you noted, or as we noted, it's an international effort, so it's nice to be part of something that's good for everyone. There's kind of 3 different ways that people will participate in this wonderful charity. One of them, of course, growing a mustache. Also, they encourage people over the month to stay active, and that's a way to bring attention to it. Sometimes people can have silly pictures with their mustache while they're doing fun things like running a marathon, etc. And so that's part of it. Every person has their own little donation page where you can kind of go through social media and solicit donations, etc. And then, for highly motivated people, they can start events. I stay busy with some other things, so I haven't organized an event for it, but definitely have fun with it.
Yeah, and as you said, being physically involved and really getting moving and making that awareness, and I know that you have a passion in that, so this plays a good part in that. But you also have other interests in community involvement,
Right.
Whether it's personal or related to university orthopedics.
Right.
So what are some of the things you're doing to promote healthy living and creating awareness?
Great, thanks. Well, a nice transition would be, though I don't have the time to organize an event for Movember, one of my passions is sudden infant death syndrome and steps to prevent this terrible disorder. So I organize a 5K in August of each year. We've done it for the last 5 years. It's called the Bella Rose Strides for Babies. It's in honor of my previous assistant's daughter who died prematurely of sudden infant death syndrome several years ago, and it's a nice way for the community to get together behind her. We get typically over 200 people, up to 300 people, per year, and that are a part of it. And there's lots of passion behind it because, the community has really rallied behind her at my previous practice, and some of her friends and family as well. So, we've been fortunate to raise over $100,000 in the last 5 years. And it's a great event. It's family friendly. We allow dogs at the race. It's at Wake Med Soccer Park. There's bounce house and face painting and a fun run. So it's a really good time. And it's something I'm very proud of because we put a lot of effort into it over the last few years, and I think that it's really shown with the success that we've had.
Yeah, and again, it goes back to being active, doing things with your family, and staying healthy.
Right.
And making people aware of the diseases that are out there and things that we can do to help prevent those. So being involved.
Right. Yeah, and that's a huge part of sports medicine to me, is the importance of staying active. So luckily with that 5K, we're able to not only have a tribute to this terrible situation and to the parents that are surviving, but also, encourage the community to be active. I think 5Ks are a wonderful example of a excellent community event that is encouraging people to stay active, because to get up and do it, you kind of have to prepare a little bit. And that preparation is the types of things that help us to live long and healthy lives.
And so you, in your practice, University Orthopedics and Sports Medicine is very involved with some creating awareness and community participation as well. Is that correct?
Definitely. So what I've been very fortunate with my transition recently over the last year and a half to University Orthopedics and Sports Medicine, that my current employer also highly values the importance of community outreach and giving back as sports medicine providers to the community through sports medicine coverage and helping to make people healthy in their physical activity. The biggest example of us doing this is our dedication to the Johnston County High School football. Dr. Aliotto has been covering Clayton High School for years. He's kind of our senior orthopedic surgeon at the group. And then more recently I've joined and I help out with West Johnston. We have a PA named Chathan that does a great job covering for Smithfield Selma High School. And then a new orthopedic surgeon that started with us in January, Dr. Gregory Tayrose, does a great job taking care of Cleveland High School.
Wow, so you guys are out there and getting involved. And so with that, you mentioned the concussion management, and so when you're out there looking at the teams or overseeing their games, that's something that you might be watching for, correct?
Definitely.
Okay.
Yeah, I've been fortunate to be out at West Johnston. They've had a great season this year. I'm pulling for them this weekend in the playoffs, and hopefully they can get real far. But we take our responsibility on the sidelines very highly, and that's definitely one of the things we're looking for, is any evidence of people with any change of mental status after they get hit. I'm especially qualified for that, but even the orthopedic surgeons that work with us are well qualified to identify at least the early signs of such things, diagnose people, get them off the field if necessary. We also take concussions very seriously, especially since I've joined the practice. As a part of our outreach to the Johnston High School we offer free baseline impact concussion cognitive testing for any Johnston County high school. And so this helps us if they have concussion, because it helps us to know when they're totally normal. There's times where people can feel totally normal, but when we test their ability to think, their cognition, this test can sometimes help us recognize people that aren't quite ready to go back and maybe save them from getting a second impact that would result in loss of school and loss of play, etc. So we're very proud of that part of the community outreach that we've done.
Yeah, and if you don't mind, I'm going to kind of skip forward to the concussion discussion, and we'll go back and talk about injections and what you do with those procedures. But since we were talking about that, I figured we'd skip ahead a little bit. So with concussion management, and we've talked about this before, our kids are in sports. I know that you guys are really involved in getting the schools on board, and really it's a national outreach to create awareness amongst coaches and teachers and things to look for with concussion. So those are, when you say a baseline, you're talking about, gathering that data. What is my normal? And if I hit my head or I have some type of injury during sports or falling, whatever the case may be, you can kind of tell, well, this isn't her normal. This is what we need to look at, or this is maybe the problems that we're having, correct?
Yeah, I mean, that's part of it. Concussions are, there's no perfect test out there for concussions. The diagnosis of concussion is based upon a change in the way you're having symptoms, or the way you're thinking, or your emotional state, or your cognition, or several other, by themselves, relatively nonspecific findings. But when you put them together with their association to a head injury, and the delay in improvement with these kinds of things, we put all that information together when we diagnose people with concussion. The baseline testing is most helpful for helping us to determine when people are ready to go back. And so it's a really nice tool to have because that's a part that it's very difficult to test for unless you have that baseline testing. There's a wide variation in how well people's memory works. And so what might be 10th percentile and low for one person, it could be 10th percentile and normal for another, because 1 out of 10 people will have a baseline level in that range. But concussion is something, as we know from several media and even movie coverage recently, is a very important topic. There's many kids that have had problems in school related to concussion, and it was not very well diagnosed and under-recognized for several years. We're doing better and better at that, and there's a lot of research that goes into that. We're lucky to have some formalized guidelines to help us with this. Every year, every 2 or so years, there's a group of experts that get together in fancy places in Europe, and they come out with guidelines. The most recent is just about due to be updated in 2013 from Zurich, but they help us with how to recognize, how to treat, the evidence for concussion. So we use that as an important part of our concussion management. And we've also been fortunate to have a very supportive legislature and government in this area that has really helped the safety of high school athletes in North Carolina. In 2011, they passed the Gefeller-Waller law that has really standardized concussion management and really helped maybe some rural areas or some less medically supported areas with a nice standard of how to recognize, how to educate, and how to manage return to play from concussion so that you're safe and so that we minimize bias from coaches or other things that might have, or sometimes it's the kid that just kind of wants to get back a little too early, but we have some excellent guidelines from that law that have helped us to save some lost school and potentially lives even, over the last few years since that was implemented.
This is great information, and of course, as a mother with a child playing sports, I've experienced the education on that through the school by sending the forms home for us to read and sign, and just really, I think that awareness is great to get it out there, and to have you in the community to be able to work with the schools and work with the kids to create that awareness and and to, of course, diagnose and treat as needed. And so if we do get a concussion, depending on the level of injury, the recovery time is, I know it's a lot of downtime, like no computers, no games, really just kind of resting your mind. And I think that's hard for kids to do, right?
Definitely.
Is that a long period of time that, that you need to rest?
So yeah, I mean, and it varies a lot. That's one of the biggest things that we have to look at when we're dealing with concussion and educate people on, because there's some people that get back better almost the next day. That's very rare. I think we thought there was a lot more of that in the past, but now that we're much more sophisticated in physical exam findings and neurocognitive testing and just the culture changing and not just patting them on the back and say, suck it up, you get better.
Right.
These cultural changes has helped us to recognize that it does affect people a little bit more than we've noted in the past. But probably the average or standard from a mild concussion that one typically gets in sports medicine is usually about 2 weeks of symptoms, maybe a week afterwards, for a slow increase in physical activity before going back. That slow increase in physical activity we think is important for multiple reasons. And it's set out in both the Feller-Waller law and as well as the Zurich guidelines. And there's different variants of it, but the whole idea is to not go immediately into a dangerous situation where you might hit your head after your symptoms have improved, and give your brain a little bit of extra time and give it a bit of a stress test by only slowly increasing your physical activity before going back. Sometimes the increase in physical activity will cause the symptoms to come back, so that's part of it. But part of it is just a little bit of an extra window, because there's probably some susceptible people that we can't really tell that they're susceptible, but if they get that second injury a little too early, they might take a long time to go back. So that's the standard of care for it. There are some tools like the impact test for cognitive abilities that if kids are bad enough on that, it does give us a little bit of prognosis that we can tell people to be expecting more like a 3, 4, even 6 weeks worth of symptoms. That can sometimes help with planning, because a large part of what we do with concussion management is to follow people throughout school and make sure that they're doing well in school and make adjustments as to what the expectations should be. So we do a lot of working with teachers, working with administrators at the school, and of course communicating with parents and kids about things. So it can vary a lot, but a lot of them are within a week or two getting better. We used to think most were within that first week, but we now know that a lot of people take a little bit longer.
And Dr. Leininger, if we have not yet been diagnosed with a concussion, what are some signs that we can look for at home with our child, or anybody that might have had some type of an injury? Are there just basic things that we should look for?
Yeah, it's generally pretty simple. What you're looking for is headache, dizziness, poor concentration, mood changes or emotional ability, light sensitivity, sound sensitivity. These sort of kind of non-specific new symptoms that have occurred typically within 48 hours of a head injury. Most of them will of course occur immediately after the injury, but there's a good bit of people that won't have symptoms for up to 24 hours out, and every once in a while even further than 24 hours out. But usually within 24 hours, people can kind of tell and they start to have symptoms.
Okay. And so the other thing that we wanted to talk about is the injections, which is one of the procedures that you do, ultrasound guided injections.
Right.
And so I wanted to get more into detail, I guess first defining what that is. And prior to the ultrasound guided injections, there's another type of injection that's kind of comparable, but so explain the two different procedures.
Yeah, of course. Thanks. So so a lot of the treatment we do is geared towards increasing people's ability to return to physical activity and the importance of physical activity, for health. And that's why I became a sports medicine doctor. And so a big part of what we do as sports medicine doctors, we don't do surgery, so we help people out in other ways to get better from injuries. And these can be simple things like therapy, icing, rest, ice, compression, elevation, simple stretching exercises, simple strengthening exercises, anti-inflammatories. These are a lot of the standard things that we do for lots of injuries. But some injuries would do better with injections. The most common injection that most people are familiar with is a cortisone injection. And historically, all of these cortisone injections have been done pretty much with just what we call landmark guided. Now, these aren't landmarks like Arches National Park. They're landmarks that we can palpate when we push on people's skin and around their joints. We can feel bony landmarks and then position the needle to certain places that, for most people at least, should get into the joint, should hit the tendon, et cetera, et cetera. And there's many things that are very superficial or close to the surface, and this is a very accurate technique to do these landmark approaches. But there's obesity epidemic here in the United States, especially here in the Southeast, and that can make some of these landmarks a little bit more difficult to palpate. And when you combine this with some joints that are a little bit difficult to hit, there's a small target there, even if you can feel some of the landmarks, or other joints like the hip that are very deep, sometimes it's nice to have a way to actually see where the needle's at to make sure it's getting exactly where you want it to be. So I don't use these for all of our injection treatments, but there's certain ones we certainly use them for when we think there's going to be a benefit for its use. The most common, of course, is the hip joint for arthritis, which is a fairly common disorder. And the hip is so deep in everyone that you can't get there unless you use some imaging, whether it's x-ray or ultrasound. Now, I prefer ultrasound because it doesn't give a radiation, but either are reasonable and appropriate techniques. We also like small joints, like what's called the AC joint here up by the shoulder. It's very small, so difficult to get into, and we'll use it to help us get in. Like, say, obese knees, sometimes we'll use them for. We do some other special injections. It's very important they get to the right spot, so we'll use them, like what's called platelet-rich plasma, and some other ones.
So when you're using the ultrasound, you can actually see where the needle's going in and guide it to the appropriate, it's more accurate as far as being able to visually see where that needle's going.
Right.
So I know you've got some examples that maybe you could talk about, we'll put on the screen.
Sure.
And you can show us kind of how that works and when you're doing that procedure.
Great.
So what do we have here?
So this is a person who's going to be getting a hip, is actually getting a hip ultrasound guided injection there. In the provider with the gloves left hand, you can see that it's gloved appropriately. There is the ultrasound probe, much like you might get when you're having a ultrasound for a baby, because we have to get deep in there. And on his right hand, you'll see that he has the syringe, and then the needle seems to be all the way into the skin in that area. And then off in the corner in the top left, you'll see the ultrasound machine, and that's where he's looking to make sure that needle's in the right spot. And that's very much what you're going to get when you have one of these procedures. You're going to be draped because it's a little bit of a sensitive area, not fully exposed, but further up than most people have on their daily basis. So we'll make sure that we cover, and then we also clean the area very closely to make sure that we keep it sterile. It's very important that we don't cause infections, et cetera, et cetera. And the next screen here kind of shows what is on the screen while we're doing it. Kind of looks like it might just be some gray blobs for a lot of people, but once you get used to looking at it, it's actually pretty well defined. What you'll see in the bottom left corner, there's kind of a raise in that white line that's kind of on the bottom part of the image, and that kind of raised hump is where the ball part of the ball and socket of the hip is located. And there's kind of a little dark halo around that ball part of the ball and socket. And that's where this person has an effusion, has a little bit extra fluid in her hip, and that's probably from the arthritis. She might have a tiny osteophyte or bone spur where the ball part of the ball and socket is maybe not 100% round there. And what you'll see is there's kind of a shadow, a white shadow from the top right going diagonally down that is the actual needle. And in real time, you can see that moving because the ultrasound picks up kind of a real-time movie of what's going on underneath the skin. And you can actually see that tip of the needle getting right to where you want it to be. And when you inject it, you can sometimes see that joint capsule actually raise up and distend as the fluid's going inside. So it makes for a pretty accurate injection, and we do quite a lot of them.
Yeah, I mean, it's very interesting to see how accurate that can be compared to, you mentioned the landmark, which is still good, you said,
Right.
you know, in a lot of cases, but having that detail with this procedure is awesome.
Right.
And so you're doing those very commonly for, you mentioned hips, you do it for knees and that kind of thing as
Yeah,
well?
sometimes knees, like say,
Okay.
a lot of knees are pretty easy to get in without it, but some knees aren't. So we also do it for that. Some shoulders, if it's really important that we get inside the joint, we'll use it for it. Like say the AC joint, we use it for it as well. Small joints in the foot and the ankle are usually a little bit more accurate if we use it, so we'll use it for those types of things as well. And different things come up, little like cysts or other things that need to be aspirated. We'll also use it diagnostically to look at cysts or other lumps and make sure that they're a lipoma versus something more, worrisome. And so it's a handy tool to have. It takes a little bit of training. My specialty, primary care sports medicine, does a lot of this. There's overlap with radiology a little bit, and there's some surgeons that will use this, but it's mostly under my specialty of primary care sports medicine.
Great. Well, thank you so much, Dr. Leininger, for all this information today. It's been a great show. I know everybody has enjoyed listening to the details of the different procedures that you do and that you're supporting. I do want to remind everybody that you're with University Orthopedics and Sports Medicine, and that is in Clayton on Springbrook Avenue, and that phone number is 919-550-3430. And we do appreciate you coming on the show today. Thank you so much.
Thank you so much. It's been a pleasure.
And please join us for another episode of Johnston Health Talk. And we look forward to you joining us again. Thank you.